right with here.
We'll wait a few more minutes because we did have a lot of people who RSVP'd that they would be on the call, so.
Good morning.
Morning.
It's Rocio.
Morning.
Good morning. All right, why don't we get started? Looks like we have most everybody on the call that said they would RSVP. So good morning, everybody. Hope everybody had a great weekend. We do have a few things on our agenda today, and we're going to start with the toolkit that we sent out that's really sector specific. And again, I'm going to ask Jennifer Weber to kind of walk us through that, since she, in conjunction with Jennifer Appleby, were really responsible for pulling all this information together. And then, of course, we want to get everybody's feedback on it. So thanks,
Sure.
Jennifer.
Yeah, no problem. So you should have all received, there's a couple minor edits that we've made to it. But basically, if you look at it, you know, it begins with the first page that includes a lot of hard links to the later sections. Basically, what we did here is we pulled from a lot of really solid, already existing information and guidelines for safely reopening various businesses. And then we wanted to give it an organizing framework so that it's easy for small business owners to access the information. So that's page 2. And then basically from 3 to 12 is all, it applies to all sectors. So this is information probably looks familiar to you because it's consistent with that original toolkit we had created. And so it goes, we're going to modify slide 4 because this phase 1 information is kind of outdated as of Friday. So we'll eliminate that table on slide 4. But as you go through, basically until you get to slide 13, it's just helpful information that applies to all sectors. And then when you get into slide 13, we get into the sector-specific information. And the main sources of information are the CDC, North Carolina Department of Health and Human Services. We have trade associations, like for the construction industry, retail. Andy's information was really helpful from the North Carolina Retail Merchants Association. So we go through construction sites, hair and nail salons, housing providers and homeless shelters, manufacturing, places of worship. This is the other area. So on slide 18, the other thing that we're beefing up, given Dina has found additional helpful information, given the fact that churches are now able to reopen, we're adding additional resources to this section in the final version. And then we go into professional service firms and office settings, restaurants, etc. We provided consistent information in the appendix to that original toolkit. So the next step after we get your feedback on this would be to make any modifications that you see are needed, and then Jennifer's team will work with Dina's team to get it live and ensure all the links are working effectively. So with that, I just open it up to any feedback people have.
Questions, feedback for us on this?
I taught Earth and White for a long time on Friday.
I'm sorry, I didn't hear you.
Is this all going to be updated with the whatever comes out this?
I'm looking at this paper if it helps all, or if you get any questions, let me know.
I'm having trouble.
Taking notes, take care. All right, bye.
Andy, who was talking? I'm sorry, I can't hear.
I was asking a question, Dina, it's Sam, Judd. Are we updating this with whatever comes out later this week in terms of the phase 2 guidelines, the dates and everything? Is this going to be published after that?
Well, I mean, that's a really good question that we should probably talk about. One of the thoughts was that we would want to get something out in advance of phase 2 so that people can start using it and getting ready. Then we may need to update it after Friday based on the additional guidance that we get when the governor releases phase 2. Now, the other thing is, I think that my understanding, and based on what he said, and everybody's heard this, is that he's looking at midweek, hopefully tomorrow, to announce phase 2, which if that's the case, then we can update it fairly quickly. But there might be some additional information we want to include once we get that.
So
A single publishing would be better than sending it out twice in a week.
Well, we could wait until Thursday and see if we get more information, or we could just wait until Monday after we get more information. It just depends on how the group feels about having people get access to information in advance so that they can.
The other thing we could do is make a note of that and to say we wanted to get the resource out to small businesses if they're planning reopening, and that we will update it with any additional information that the governor's office is related to phase 2. We can make a note of that so people need to know that they need to go back to it.
Yeah, and I would ask, if you're not talking, if you could put yourself on mute, because we're getting a bunch of feedback, so thank you. So what's the consensus of the group in terms of how we should proceed, with the timing of the document?
this is Uday here from Carolina Business Alliance. I think the best approach is send that out, and then with the caveat saying that there is more updates going to come in the middle of the week, and look out for the updates. That is better, because whatever we have here, people can start preparing for reopening. That's my thought.
Okay.
Tina, this is Michael Smith. If we're going to print now, we ought to have some kind of reference in the sections that are going to change, that date it and say you need to check back as of this date for this information, just so that people know to not rely on something that's going to be so time bound.
Okay, we can do that. Other thoughts? Are there other sectors that we didn't hit that you think we might need to include? Seem pretty comprehensive, but I want to make sure there's not something else out there that we didn't touch on that we think is important. Okay.
Dina, this is Clay. I know we have hotels, but congregant facilities. I know you have hotels, but still thinking about, dormitories. If there's any, I've been looking all over the place to try to get some guidance in that area. So that would be the only thing as we try to open up for the fall. That's the only thing. But I thought it was very, very good work.
And Dina, this is Sam Judd again. I wonder if in the retail establishments, and maybe it's in there in a link somewhere, but I think fitness is not specifically mentioned in here. And I think there's a lot of questions around how that can work.
Yeah, that's a great point. We can go back and look at fitness.
So I'll go look for further guidance both on universities as well as fitness to see if we can find some robust information out there and include a section on it.
Do we have specific information for, say, summer camps or kind of activity-based children's gatherings coming into the summertime months? I know I've gotten a lot of calls and questions about whether camps can go forward or what they need to do.
There's special guidance. I know that the states come out with special guidance, and we can include that in here as well. But you want to just speak to that briefly, Gibby? So I know you've been tracking that.
Sure. There is specific guidance that came out from the state on day camps. And just recently, they have decided to allow overnight camps as well. And there was some specific guidance that came out about that late last week. So we could make sure that that's included. I'll also just mention that we understand that the state is working on specific guidance for higher education. We thought we'd have that last week. We haven't gotten it yet. So hopefully that's coming fairly quickly.
Thanks, Gibby. Yeah, I just heard that. I was going to say that. I heard that on the CLC call this morning that the governor's office is working on something on higher ed. So appreciate you guys keep fighting in there for us. Thank you.
Yes.
Dina, this is Andy Ellen. Just a question on a lot of the documents and guidance we've been doing just because of the corporate practice of law prohibition. We've been having some sort of caveat that this is not intended to be legal advice, and that somebody should, if they need legal advice, need to contact an attorney or some other type of regulatory agency, just as protection for legal responsibilities. Just as a side.
That's good feedback. We'll make sure we include that.
So put it at the very end. We can put a disclaimer. And Dina, if there's typical disclaimer language that the county uses, we could incorporate that. Do you have, if you wanted to send that to me, we can put that at the end of it.
Okay. All right.
So far to recap, we're going to add, I just want to summarize what I've heard in terms of feedback. We're going to add a date stamp on this and indicate when, so we'll say it's the guidance is as of May 19th. Then we'll indicate when we update it. We can say updated as of once we get once we get guidance from the governor's office, hopefully mid this week. We're going to, I'll add resources for fitness, summer camps, both day and overnight camps. And then we'll also add universities and colleges, although if the governor's office is coming out with additional guidance on that, that might be the section that we indicate that and note that we're awaiting further guidance and direction from the governor's office on that, if that was announced on the CELC call. So those are the main things: summer camps, fitness, universities, and then making sure that it's clear what the guidelines are. And then we'll add a disclaimer at the end.
Jennifer, this is Uday here. One quick thing, I was going through the document. Are there any links to the smaller clinics and dental offices, because they are planning to open up as well, right, next week?
I can look for that to see if there's any guidance on dental offices. I can't recall if I know I saw fitness facilities. I know I saw day camps when I was out there looking at all the resources available. So let me revisit that and see if I can find something.
There is specific guidance from ADA that most of the dental offices are going by. That's where I would suggest referring. The other question we're getting a lot of calls about are pools. And we are continuing to wait for specific guidance from the state on when pools can open. we're going ahead and permitting them so that they can be prepared to open when the governor's office allows that. But at this point, we have not gotten anything specific about pools. Other than those that are involved in camps, they can be used. But public pools in apartment complexes, those sorts of things are still to be closed.
Okay, so for the pool and for the university sections, do you think the best approach is to indicate that guidance is forthcoming from the governor's office and that we will update it accordingly?
I think that would be the best approach at this point.
Okay.
Hey, Dina, this is Mark. Quick feedback on the document. So on slide 15 with hair and nail salons, I'm wondering if we should take the reopening guidance. For service delivery, there's some bullet points inside that document that I'm wondering if we should replace that share facts about COVID-19, move that down somewhere, just add some general bullet points out there on the service delivery. So what we're expecting our hair and nail salons to, how they would deliver that service. You know, so it's more front and center in someone's face. And then the I would say on that slide, we may want to think about just saying, adding barbershops to that verbiage. So, hair and nail salons. So it's just a suggestion for the group to discuss. Thank you.
Jennifer and Dina, this is Michael Marsicano. Congratulations. This represents a lot of work and it's well done, and these are improvements. Have you mentioned, and did I miss it, or are we going to talk about what's the distribution mechanism?
No, we can talk about that. We didn't talk about that yet. We were the last toolkit we did, we put on our website, and our folks, pushed it out through all of our regular channels, and we can do the same here. We can certainly, ask all of you to push it out, which is what we did last time. We asked you to push it out through your social media channels and websites and put the link there. So it appeared as if it had pretty wide distribution. But if folks think otherwise, need to think of something else, we're happy to do that.
Dina, is Jennifer Appleby. Do you have any kind of data about number of downloads yet? Are people utilizing it?
I don't know. I'd have to check. I'm not sure.
So Dina, this is Michael again. So, we have about, 700 or 800 different nonprofit endowment funds that we communicate with those nonprofits all the time. It just didn't occur to me to send this to them, but I will. Perhaps getting the United Way to do the same thing, the Arts and Science Council, these umbrella groups, maybe a extra pitch to them to do it. I don't know. Michael Smith seems to have a great list of small businesses downtown. I don't know how intentional we've been, and I admit I have not, so I will now do so.
Okay. Well, we can.
I don't know if there's some way to rally the umbrella groups to help.
Okay. That's great advice. Thank you.
We'll be glad to be a part of that distribution. Maybe it's worth setting up a small subcommittee of this group that just focuses on communications, little earned media, and how we distribute it. And do you think we need a separate section for music venues, cultural arts, sports venues? Do we need any kind of specific resource section for that? And again, to echo what Michael said, this is incredible work, Jennifer and Jennifer.
So Michael, there is guidance out there on public gatherings that I could easily, we could easily link to. And that would include, music venues and things like that. It's a broad category of public venues and gathering places.
The thing that I think we need to be mindful of is I don't think those are eligible to open until phase 3. And if we put it in our guidance, I'm afraid people are going to think that it's okay to open. And so I'd rather us just stick to what we think phase 2 is going to look like. And then when we get to phase 3, we can, expand the document even more.
So
point.
let me say too, there was a group called the North Carolina Live Coalition that's comprised of North Carolina's largest entertainment venues: Duke Energy Center, DPAC, Red Hat, Greensboro Coliseum. I'm sure some of the Charlotte ones. That is evidently putting together a set of guidelines. I just saw that popped up at 9:30 this morning. When they're able to open, so that's coming. I know from this group as well. So.
Yeah, Dina, this is Fred. Can I just chime in on that?
Of course.
So we do have representation on that group, and Jack Cecil, who's the president of Biltmore Farms in Asheville, and I serve with a lot of folks on this call on the governor's North Carolina Business Economic Recovery Task Force, and that group asked he and I to lead an effort in helping put together some recommendations for he and his team to consider as they look at guidelines in phase 2 of restaurants and hospitality venues. And in addition, those are mass gatherings. So to your point, Dina, I'm not sure there'll be a lot of movement on mass gatherings. I anticipate there being some, but I think most of the movement on those type venues will be in phase 3 and afterwards.
Okay, thanks.
Sure.
So is a consensus on that topic then to wait until we're approaching phase 3 to include that guidance, particularly if a lot of these larger venues are coming out with their own approach. We may want to see how that shapes up and then include it in as we're leading into phase 3. Dina, what's your preference on that?
I think we should wait until we get more into phase 3.
Okay, I just wanted to make sure there was consensus on that. Okay.
Jennifer, I'm not sure how much guidance we have on hospitality venues, but I think there should be some guidance that'll be coming out from the governor's office on restaurants and things of that sort. And I think that should definitely be included.
Okay.
When is that coming, Fred? You know?
It'll be a part of his phase 2 approach.
Terrific.
Sure.
The other, I think that Clay raised this and we didn't kind of close the loop on that, is hotels. I know a lot of hotel chains are coming up with their own guidance, but is it another area that we want to at least include some links on, particularly smaller independents?
So Dina, that's a part of the same guidelines that'll come out in phase 2. So it includes hotels and restaurants as part of the hospitality industry.
Okay, perfect.
Since we're still uncertain about how, it sounds like we know what's coming, but there may be other guidance from the governor's office that we can't even anticipate today. So I'll just make it very clear that the information will be updated after further guidance from Governor Cooper's office as we move into phase 2. We'll just make that very, very clear on the document. And then that gives us some leeway to kind of study what he comes out with this week, and then where appropriate to update the information accordingly.
I think that's a great approach.
Okay.
Any other comments on this before we move to the next topic? Okay, I just want to let Rocio know that I got the names of those 2 printing companies that you put in the chat. And I'll send those to Jennifer. She had a couple of other small printing companies she wanted to add to the document. So if you look in the chat, you'll see them.
Okay. I'll just pull it right from the chat, Dina. You don't need to do anything. I'll pull it right from here.
Okay.
Okay.
Terrific. All right. And so the next item on our agenda is around communication. We talked about this a lot at the last meeting, around trying to do better communication and messaging around the whole topic of face coverings and social distancing. And Jennifer Appleby of Ray Ward was kind enough to put together a really good summary of things that we might want to consider. And so I'm going to ask her to walk us through her document, and then we can talk about some next steps there. I think the whole issue of face coverings continues to be an interesting one. And I think if you go out now and you venture out, you can see how many people are covering their faces and how many people are not covering their faces. But we do know that it really is the best way to keep the virus from spreading. So we just want to really do what we can to try to make sure we get that message out. So with that, I'll turn it over to Jennifer Appleby.
Great, thanks, Dina. I think you've got the document, and I'll just run through pretty quickly some of these ideas. But before I get into that, I think that, one of the biggest questions that we need to ask ourselves is, do we want this to be a small grassroots effort, or, do we have some money to put behind some paid media to really kind of bolster and boost the messaging and the reach out there in the community? So, we started with, some creative theme ideas. Dina said, how can we get some creative messaging out there? And, this was just kind of a first step at a list, using, you can use empathy, you can use, some humor. We could even push it a little further and use some, more kind of scare type of language just to wake people up and get them to realize that, this is really important. And, to use masks and distance, not just for themselves, but for our more vulnerable community and citizens. So those were some of the themes. And then we, talked about using more traditional tactics from, public relations and foundation social media to lots of different partnerships. By the way, some of your organizations may show up in this, so thanks in advance for letting us tap into your resources. Lots of media relations, from news releases to press outreach. We can certainly work with the county on that and making sure that, we use the media to help us get the message out. If it's a PSA campaign, we can also, we can write scripts and get the more traditional media outlets from, TV, radio, outdoor, to share those messages and incorporate that into the programs that they've got running. To more sort of digital, innovative things like music app advertising. So we can think about that if we've got some money on the paid side. Developing a whole social media sort of graphics kit that we could go ahead and incorporate even into, some of these documents we're creating, so that people can pick up on those, but spread them out to all the organizations and get them to use them. We also, just side note, reached out to several other agencies in town, including specific agencies that have a specialty in Hispanic marketing to make sure we get the cultural and language translations right. And we've had a great response in other agencies that want to step up. So we're trying to form an alliance and getting other agencies to contribute to this cause. So I think that's something that's pretty exciting. Other creative tactics, I mentioned partnerships. We had some really fun creative ideas around leveraging, partnerships with our NASCAR friends. And, with that season kicking off, there might be some ways we can get the word out through their race schedule and kind of what they're doing. And you can see those ideas there. To again, partnering with lots of radio stations and, capitalizing on, some songs out there that might relate to distancing or masking. Working with the Charlotte Agenda maybe to create a fun program in, who's wearing masks and kind of what their story is. I don't know if you know about Clean Graffiti, but it's a really innovative, non-traditional way to get messaging out, and we can have sort of a surprise and delight messaging on sidewalks or parks with the messaging to make sure that they're being safe, wearing masks and distancing. And then, identifying some of our small businesses that are already doing some really innovative things. I don't know if you all follow what Amelie's is doing, but they're doing some really interesting things. But, maybe you get a consortium of small businesses and you do something like a fun, painted rock campaign, or just something smaller that would be, again, a surprise and delight, non-paid messaging. And then maybe, if they see that, they get a reward for practicing safety with some of those small businesses. You've seen that artists are doing some really interesting, innovative things. And, we had the idea of perhaps temporarily, masking some of our murals or statues around town, just as a reminder. And let's see, around showing the distance, partnering with some of our sports franchises with the Panthers, maybe, to show what 6 feet looks like. You use some of the players, with some fun language, like you must have at least one Luke Kuechly between you and the person ahead of you. So I think that would be fun and show sort of what that looks like. Getting CMS, although we're coming to the school year end, but getting our teachers and local students to draw on sidewalks. We've seen some of that happening. Tapping into the Carolina Raptor Center to show wingspans and what 6 feet looks like. To the Whitewater Center and showing kayaks and rafts. So all sort of creative ideas around that. We think shareable social graphics are really, really important. And there's an example of a company in Atlanta, and I'll let you look at that, but it's a great Instagram campaign. So, we could certainly do some of that. My why content creation, I think, will be something that, could get a lot of attention, sort of along the lines of The Humans of New York, if you know that book, and that work. But why I'm wearing my mask. Storytelling, I think, could be really valuable, emotional, and important through this. And then maybe we use sort of, local influential business or community leaders to share their stories, whether they're in media or corporate America. But getting people to sort of share their stories, inviting them in, and then, letting them spread the word, we think is a good idea. And then last, I don't know about you, but TikTok has gone crazy. I never thought I would recommend this as a tactic, but maybe there's a way we could do something fun with the local Fox weathermen to do something that might go viral. So those were some of the ideas that we had. Some more fun, but with a very broad community. Using some humor, some things that can be passed along, we think is a good idea. One more thing before I'll be quiet and just get some feedback. When I reached out to Peggy Brookhouse at LGA, she shared a campaign that North Carolina is doing. It's called Count on Me NC, and it's already in place. I think the governor is going to announce it on Wednesday. But this idea of sort of taking responsibility and signing up. And I've asked whether we could connect with that, and if that campaign would be usable, and then we could localize it with some specific local messaging. I think it shows unity and building on something that's already done. So she's going to talk to her client and see if there's a way to do that. So I'll be quiet for a minute and take any questions or feedback. But again, these are just ideas. It's not a built-out plan. And I would be very interested in learning from the group whether or not we would have the opportunity to put some money behind a paid campaign.
Thanks, Jennifer. Thanks for doing this. Yeah, Michael, go ahead.
This is Michael Marsicano. First off, I love the creativity. So well done. And I don't know if you mentioned this, but just in watching the media, what other communities are doing, and you may have mentioned this one, and I just missed it. Dina, New York is, all its parks, it's putting circles on all the grass.
Yes.
That are painted, and that people are actually sitting in the circles and they're not going outside of them. So I think all of these creative ideas are terrific, and we should do them. And there's a front page article in the Observer today about how those of us that are out are shaming people into by our actions into wearing them. So lots of good non-paid stuff going on. I am one that's really big on this. When you see the data, I think I brought this up last time, it's so compelling on the mask issue. And especially looking toward RNC coming, I would like to see us do some paid, also go creative, and maybe in combination with billboards. Maybe we pay some, but then we get some free. So we bargain with the paid providers. I'm willing, and I'd like to hear what Dina and Mark in particular, or anybody else who's on the COVID Response Fund committee, Is this something that we should consider putting some money towards from that fund? And if so, does Jennifer have any idea of what a robust but not break the piggy bank campaign would look like?
Hey, Michael, let me comment. I'm
Jennifer, you're muted.
sorry. I'm so glad you brought up the circles in Brooklyn. They're fantastic, and I think that's a great kind of creative idea, and we'll include those. The other thing I should have added is there are several companies, you may be on the call, that are spending paid media dollars with masking messages. So I know Novant is doing some of that work. It would be great to kind of know who's spending that money and build on those. So I think that could kind of tie into everything we're doing. So, maybe we do. I liked Michael Smith's suggestion of a smaller kind of communications committee. But it would be great to know so that we're not sort of overlapping with that messaging, but leveraging and tying them all together.
Well, I think that would be terrific. And I'm not trying to cavalierly spend the COVID response fund money, because God knows we're seeing how much food is needed and shelter and utilities and all of that. But if this is going to prevent some of that, it might be a good expenditure if the grants committee saw clear to do that. And again, if Mark and Dina and other members of that committee that are on the phone don't think that's a good idea, I don't want to be putting that on the table. So if they have any thoughts of that, but yes, if we could coordinate it with others and spend less of that money, that would be great.
Mark, Jarrell, did you want to comment?
Yeah, Dina, thanks. Michael, I think that's a great consideration. I would say definitely need to have that coordination as you talked about. I would love to see other entities come to the table as well, and just get more information about what the campaign would look like. But I did have one other comment to Jenny, and I know this is sort of old school. Have we considered any sort of direct mail postcards or anything hitting our residents with some reminders or anything like that?
I think that's to me, Mark. We certainly could think about that. And if there's ways to overlap with water bills, something that's already going to our citizens with some sort of an insert message, I think we could be really creative with, how we get to those folks. We've done some really creative things with, little door hangers and other things, but I think we need to kind of think about the whole safety piece of that also. But yeah, if you've got ideas, let us know. One other thing that I should have added, when we put together a program for CLT 250, we were able to work with all the local media to get basically a kind of a 2-for-1. So we could negotiate and, with a little bit of paid and get them to also kick in. So I do think that they would be very interested in, helping get the word out from a PSA standpoint. But it's always incredible what they'll do if you have a little bit of money to spend. So those are some things that we can be thinking about.
Well, I'm definitely on board for a spend of some sort. I just wanted to understand better what, the campaign would encompass. What are we spending on? What that delivery mechanism looks like. But certainly, I think from what I observed here recently, people are not masking up still. I mean, there's just too few people in the community masking up. And so we do have to get the message. I am concerned about being too heavily reliant on as opposed to directly getting to folks that may not have access. Obviously, we know there's a digital divide. So I want to be able, and that's why I brought up the direct mail piece, door hanger, to that nature. So thank you.
Tina?
Yes. Well, Mark, I think somebody
Carol? Michael, let Carol go first. Carol.
Very quickly, thank you. Love this conversation because, as you know, we definitely believe in masking. We also realize it can't be completely enforced, so the highest recommendation is masking. But this, to me, is about creating a movement because people know about social distancing. It's poking them into action. And how do you make it cool to do that? So I think the best way, and Jennifer, love the ideas you've played out, but particularly the ones about getting a smaller group together probably and making the message so clear and simple and engaging that people actually go with it. And Atrium would be all in terms of really trying to work together with everybody else on these messages. So thank you. Love the direction of this.
Thanks, Carol.
Jennifer, this is Pat. You may have mentioned this, but have we asked for any assistance from the Ad Council or billboard messaging?
So I reached out to the local 4As, also the local guy, to see if they could help us with that. So the call is out, have not heard back, but I will keep you posted on that.
Jennifer, there's a standing corporate communications and like large PR group that gets together regularly. They'd be a natural group to kind of augment and serve as kind of subcommittee to help with some kind of rollout like this.
Great.
Lastly,
Michael.
And I'm sorry?
I said, who comprises that group?
There's a group from the CRVA, the city, the county, Center City Partners, the Alliance, and then a lot of large corporations have their lead CorpCom folks that are a part of it. It kind of meets in two layers. Very effective, though, and a lot of great minds. We've used it for a number of things, including national PR. We used them for CLT 250. They're ready to be deployed.
So will you convene them with Jennifer Appleby and take this on for us?
Yes.
Thank you. That's great, because it's already a committee that knows how to do this work, and I think that'd be awesome. If there's anybody else on this group that wants to participate in that, let me know, or let Michael Smith know, and he can pull you in. But yeah, I think that's a great piece of infrastructure that would be helpful here. Thank you.
And anybody that's on this call that may not have, that represents a large corporation that has CorpCom folks that would like to be a part of this, we'd love to pull you in for this and other stuff.
Michael, this is Uday here from Carolina Business Alliance. We would love to come and participate. There are some organizations and corporations that can contribute and have been contributing last 4 or 5 weeks. So we can definitely join.
Perfect. Thank you.
Hey, Dina, this is Mark again. I also want to remind everybody on the call that, Atrium and Novant are out in the community with their with the testing units. So there may be an opportunity there for us to leverage additional material through our partners at both Atrium and Novant, because they are already in the community and are doing a great job for us. So just another thought.
Yeah, I agree with that. That's a really good resource.
We'd love to.
Michael Marsicano. Yep.
One other suggestion is to use some of our arts groups in this communication campaign with their creativity, and perhaps even using, if we're going to fund something, we fund something that puts artists who don't have work right now to work.
That's a great idea.
Love that idea.
And even a contest at the Mint over the fashion of masks could even be a Jennifer Appleby debuts on the runway with her mask.
Or you.
I'll design it for you. I'm going to design it, Jennifer, and then.
Okay.
Yeah, we're going to
that only means
reserve Charles. We'll reserve Charles for the TikTok dance videos.
Yes.
Dina, this is Gibby too. I'd like to offer Raynard Washington, our Deputy Health Director, to participate as well. We're already doing some work in this area and would like to make sure that it's all connected.
Okay. Thanks, Gib.
I think we got to make it cool because it's not working otherwise.
Yeah.
We got to find a way to make it cool and have leaders who are out there, showing off their mask and making it fun.
Yep.
I agree. Michael Marsicano, I know you wanted to say something and I cut you off. Is there something you wanted to add at this point?
No, I'm good. I'm good. Thank you.
Okay. Well, I think this is going to be great. And I don't know, Michael Smith, and Jennifer Appleby, what do you think is sort of a time frame for which we could, get this thing ready to launch? what's a reasonable kind of time frame to get this done?
Michael, how quickly could you get your group together?
I'm sending text out right now to try to get them circled up. It's a busy group, but I bet you get the core of them together in less than a week.
Okay.
So, early next week, maybe Monday. And
I know this is shocking to everybody, but Monday's actually a holiday, but
thank you for that. I will not be observing. We'll pull them together quickly. I'll get on the line with Jennifer, and we can do a little coordination about that.
great. Well, I'm really excited about this. I think it's going to be a great piece of work from this group and the group Michael's putting together to really try to move the needle on this piece. Okay, other questions on this topic? Okay. And so again, now I'm going to turn it over to Gibby because at every meeting she talks to us about our data. And today is no different. I don't know if you have new data today yet, Gibby, but give us what you've got so far and go from there.
Okay, so as of this morning, we have 2,695 confirmed cases in Mecklenburg County. That's more than twice as many as the next largest county, Wake. We have 69 deaths to date, and we now have 15 long-term care facilities that are in outbreak status. The other area that we're seeing a good number of cases, an increase, and I was pleased to see some information in the toolkit around construction sites because we are seeing some outbreaks in construction sites that we need to pay attention to. A third of our cases now are among Hispanics. That number is rising fairly rapidly. And most of these are young Hispanics. We're seeing a good number in individuals less than 20, but the majority of them are in the 20 to 39 age group. And this is a group that we're going to need to really bear down on with this communication plan we're talking about and getting information out to them about masking and social distancing. We're doing some of that now, but I think we really need to focus on that moving forward. And let's see, lastly, our trends that we're seeing in the last 14 days, we've seen our hospitalizations are stable. The percent positives have decreased slightly. And we're seeing a slight decrease in social distancing, which is not surprising as things are opening up. We are seeing a good bit of increased testing. Both of our hospital systems are testing a lot. We have some other smaller entities out in the community that are doing more testing. And because of that, we are seeing some significant increase in our positives as well. But as I mentioned earlier, our percent positives we've seen a slight decrease in. So we're fairly stable right now based on the information that we have to date. And we'll continue to watch that closely as we open things up. We're not sure at this point what kind of impact the reduction in restrictions is going to have. So it's going to be critical for us to keep a close eye on that. So that's what I've got this morning.
So Gibby, I know after last week's meeting, I know when the data came out last week, I know you and Rocio got together and had some conversations, and I didn't know, Rocio, if you had an opportunity to look at the data for the Latino population and be able to provide us some insight into how we might be able to message that more effectively or do some more outreach to that community to try to stem that tide. You're on mute, Rocio.
Well, until she comes on, we did.
There
she is.
There are several groups pulling together the Latino leaders within the community to try to figure out the same way that you have come up with great ideas on how can we have low-key distancing and things like that would be more in line to what we need to say to the Hispanic population. And what we have come to an agreement is that sometimes health is not as important as their economy and as their ability to pay the rent and feed their families. So we're trying to message this more in line with, if we are protecting ourselves, the sooner we protect ourselves and we take care of ourselves, the sooner we'll be going back to work and going back to school and taking care of our families. So Gibi, thank you so much for pulling together your department. There's some things happening behind the scenes, so I will be reaching out to you again this week to see how we can marry these great ideas that you have provided today in regards to reaching out to the community to kind of also extend them to be more in line with the Latino community and the messaging that will work out. Thank you.
So Rocio, if there's somebody, either yourself or somebody else that you'd like to be on this committee doing this messaging, I think that would be really helpful to make sure that we don't miss those important messages for that community. So if you want to let Michael Smith know who you think would be good for that, I think that would be great.
Thank you. Thank you. I would like to participate and then bring one or two more people so that we can have different points of view.
That'd be great.
I look forward to hearing from you.
Okay. Thank you, Michael. Thanks.
Gibby, were you going to add anything in terms of outreach to the Latino community?
No, we have, we are doing some radio buys. We're doing a lot of interviews with the Latino media around these issues. And we pulled in a couple of our staff who have relationships with Rocio and others in the Latino community to help us get some of those messages out, but really look forward to continuing, as I said, to sort of bear down on this issue. We're seeing the significant impact that it's having. You know, and there are a number of reasons for that, but as much as we can work with Rocio and others, I think we'll have a better chance of getting the right messaging out to that population.
Excuse me, I would like to also interject and add something too. I need to get off this call right now, but mainly because around 10:30, I am going to be speaking to a very big coalition of pastors and members of the religious groups among the Hispanics. It is also believed that there is a big thought that God will protect us, and that's why we should not be wearing masks, because we are protected by God. So I am going to take advantage of being in front of about 30 different leaders of their clergy and religious organizations to ask if they could please support us in sharing the information and how important it is to protect themselves, to follow the guidelines of social distancing and wearing masks, and invite them on Thursday afternoon to come and have their free masks provided by Novant Health. So just know that behind the scenes, we're also trying to disseminate these messages to see how we can get to the hearts of the Latino community that are somehow not wearing the mask. And also, I wanted to find out if there's an opportunity to speak with the owners of these large construction companies, because I feel it is my personal opinion that they should also be in charge of providing the protective equipment to their employees. So I would like to know what efforts are being done in making them responsible so that their employees are also protected and following the rules. Thank you.
So I don't know if Pat Rogers is still on the line. I was going to ask her for her guidance on that. But, you know, Rocio, there's also a group that put together guidance on safety on construction sites. And actually, I gave that to Jennifer, and she included that. But I think I can find out the name of the person who led that group, which has all the major construction companies on it. So maybe is there a way we can hook up with them and see what we can do to try to bear down on that a little bit more? Gibby.
And I do want you to know that we are having lots of conversation with the different construction groups and working with them with the folks that are infected, but also in trying to get them to be a little more responsible in providing PPE and social distancing on those sites, as well as enforcing it. You know, there are several different layers of issues here, but there is some significant effort going in that direction as well. And Rocio will be happy to talk to you about that some more.
Great. And I did want to just circle back on Jennifer Appleby asked me how many page views or downloads we had with the toolkit, and it appears as if we had 2,136 page views since the toolkit went up 8 days ago. So I think that's a pretty good number, but we should try to push it out even more and make sure people have that. So, so that's what we had on the agenda today. So we've got some work to do on the resource guide for the sectors, and we'll work on that. And then we've got this group that's going to get together and work on our communication and messaging work. And then we'll go from there, and I will schedule another meeting for us mid next week so that we can see how we're doing. Does anybody have anything else they want the group to consider today?
Dina, just a clarification question. Is the smaller group going to pencil out some numbers of what this might cost to educate in our community?
Michael, Smith, Jennifer, is that part of what you're going to do?
Yeah, I think Jennifer is the best capable of doing that, but I'll make sure that's part of the work that we do and that we bring that back to the group. And also the conversation on the construction industry and what we're seeing there. Next time we're together, it might be worth putting something on the agenda to hear from Pat Rogers, because the way the construction industry organized has been one of the best practices that others have looked to, the way competitors came together to co-create process for safety and protocols, and they're checking in every week, and there actually is a lot of great work going on there. We ought to hear from them because it might inform some other industries as well.
Okay, I'll take it.
Hey, Dina, this is Mark. Quick question for you. How feasible would it be for Peter Zeiler's group to email the link to the toolkit to everybody that's in the hub, the historically underutilized business database? Since
I'll check.
access to it. Okay,
Yeah,
thank you.
that's a great idea. All right. All right. Great, everybody. Always enjoy our time, and look forward to getting together next week. Have a wonderful Memorial Day weekend, everybody. Thank you.
You too,
Thank
Dina.
you.
Thanks so much.
Thank you, Dina.
Thanks, everybody.
Thanks, Dina.